Today I'm going to speak about common orthopedic pathology in the geriatric group of patients. As we all know, the geriatric group means persons who have aged, persons who have gotten to an age that we consider elderly. That is a debatable topic today because what is elderly is basically a problem, but the group of people that I attend to with these conditions are usually considered to be above 55, 60 years of age. Now, one of the most common conditions that we have in persons who have passed 40 years old is the initiation of osteoarthritis. Now, osteoarthritis is a degenerative process of joints, and actually it's not really osteoarthritis. It should be considered osteoarthrosis, which is degeneration and not inflammation. However, the joint ends up becoming inflamed because of debris from wear and tear that irritates the synovium and makes the joint become inflamed. But really it's an osteoarthrosis or degenerative process. Now, the degenerative process in patients usually starts at about age 30. We say in your third decade of life, you already start getting degenerate changes. However, the degenerate changes will take you to consult with a doctor at about age 40 or 45. There seems to be an associated genetic and hereditary factor that comes into play that makes some people become more degenerated than others. But there are many other multiple factors like diet, exercise, occupation, injuries, prior injuries that you may have had during your life that can make you have degeneration to your joints, which could be earlier or later. It's important to note that when we speak of osteoarthritis, osteoarthritis is specifically degenerative, whereas there are other forms of arthritis like septic arthritis, gouty arthritis, rheumatoid arthritis, and other forms of generalized or systemic conditions like lupus that can give you arthritic manifestations. Psoriasis can give you arthritic manifestations. But these are not conditions that are directly related to aging. And today we are speaking mainly about the conditions that are related to aging. Now, so the patient that comes to our clinic with an osteoarthritic condition will tend to come with symptoms like morning stiffness, pains, sometimes swelling that could progressively worsen, and then the patient would have difficulty probably to walk, and the condition progresses to a point where the patient will need some form of assistance, be it a cane, a walker, or sometimes it could become as devastating as making the patient needing to use a wheelchair, or sometimes they can become bedridden. Now, this is not something to be very, very concerned about in Guyana in the present day, because before the year 2000, most of these patients were condemned to having to accept their disability and not have anything done about it. Today in Guyana, this has changed. Now we are able to do replacements of the joints or other interventions that are very, very helpful to these patients that can actually make these patients get back to what we consider a better form of life. So usually patients who come with osteoarthritis, especially if they have reached to a grade 3 or grade 4 degenerate change where the cartilage is completely worn out in the joint, these patients will need to have an intervention done known as a joint replacement surgery. Now, joint replacement surgery in Guyana today is done mainly of the hip and of the knee. The other joints can be replaced, like the ankle and the elbows and the shoulders, but so far, to my knowledge, there isn't any institution that has advanced to the point that we're doing shoulders or ankles or fingers or wrists. So mainly we do total joints of the hip and the knee. Now, this is a simple process, even though it's a big surgery and most patients are very fearful of the whole idea of having surgery done, especially when it comes to doing such a big surgery like replacing your knee or replacing your hip. But it's not as difficult for the patient as it seems, because the quality of life after the surgery is something that is desirable. And when patients have had this surgery, then they recognize that, the decision to do the surgery most times is a wise one. The total knee replacement just simply entails the removing of all of the destroyed or degenerate cartilage in the knee. That means the femoral condyles and the tibial plateau. And this is replaced by either stainless steel or a titanium implant that looks very much like the condyles and like the tibial plateau. And there's an insert in between the joint known as the polyethylene spacer, and that works like your meniscus as a buffer in the joint that allows you to walk on the joint comfortably. So there is no reason to be afraid of having a replacement of your joint. It is done locally in Guyana, and we have been having quite good results replacing people's knees. Hips are also replaced, and even though there are many forms and types of replacements for the hip, the one that is used in Guyana mainly by me is a hip replacement that is a cemented type of hip replacement. There are cemented and non-cemented hip replacements, as well as their hybrids. The non-cemented hip replacement has been touted to be better for persons in the younger age group. So the one that we use has targeted the age group that I'm speaking about, the geriatric age group, where the quality of the bone is soft, it's degenerated, so you probably need to assist the union of the implant to the bone with cement or methyl methacrylate. The hip is actually done similar to the knee, that the cup, which the hip is known as a ball and socket joint. So the cup is replaced by what is known as an acetabular cup that takes the shape of a cup, and that's cemented in place by bone cement, and the stem is implanted to simulate the same shape or form of the femoral head and neck. And when the two are put together, the patient is able to walk and do quite well. So those are the two main total joints for the conditions that are seen in the most frequent conditions seen in the geriatric population in orthopedics. That is osteoarthritis. So basically, if you have a condition known as osteoarthritis or osteoarthrosis of your joints, the orthopedic surgeon is probably the person that you should see. And once confirmed, and if your condition is, I'm certain that some of you out there are wondering what can be done if you would like to prevent yourself from getting osteoarthritis or osteoarthrosis. Now, prevention, of course, has a lot to do with the things that I spoke about initially, meaning your lifestyle, your diet, keeping your weight down, your exercise regime. But remember, not because you have done all of these things will exempt you from osteoarthritis. Sometimes osteoarthritis has, like I said before, a genetic and a familiar relationship. So sometimes some people, even though they have been trying everything in the book to help themselves prevent degeneration, it's completely not preventable in everyone because of genetics. But yes, you can slow down the process by weight loss, by exercise, by adequate diet. And that may help you from having to consult with us to do something to your joint.